So this next one is quite specific for multiple myeloma scenario. So I'll say the question for Dr. Cooper Ryder, although we might want to make it more of a more broad, how do you approach post VRD and maybe explain what VRD is. But the question is, do we give a patient with multiple myeloma on pancreas and pelvis any algorithm to cure after VRD cocktail chemotherapy and acupuncture and traditional herbal medicines a year in stringent remission and collected stem cell without bone marrow transplant, VRD light maintenance therapy a year, and Velcade chemotherapy 7 years? Dr. Kuberta, are you actually able to see the text of the
Yeah,
Q&A?
yeah.
Okay.
It sounds to me like this person's describing a situation in which they've had a very good response to what we call triplet therapy. So I talked about it's either usually 3 or 4 drugs that we use in combination in the frontline setting. And so VRD is a combination of 3 medications. So Velcade or bortezomib, which is a proteasome inhibitor, Revlimid or lenalidomide, which is an IMiD, and dexamethasone. And that was sort of before daratumumab was approved. That was the standard of care frontline therapy. And so it sounds like this patient has had a very good response to therapy, including maintenance therapy and a long course of Velcade chemotherapy as well. So obviously, I won't answer necessarily for this exact situation, but as as we said, kind of zooming out, is there a way to maybe call a situation a cure? It goes back a little bit to what we were talking about earlier. I think we're using a lot of MRD negativity now, looking for sort of 1 in a million cells to figure out if a person is in the deepest response that we can detect. And so we did a trial called MRD to Stop, which was hypothesis generating, which was a trial where basically we discontinued maintenance therapy in patients who had achieved MRD negativity at 1 in a million cells. And they had done that they had achieved that, after at least a year of maintenance therapy. Dr. Derman at our center led that trial. And what we found is that 3 years later, 85% of patients who achieved that deep level of response are still in remission, which is nice, right? I think that what we've found, what we're finding more and more in myeloma is that patients that achieve this really deep response may actually, maybe functionally be cured or at least can be off therapy for some period of time, that maybe they're not getting additional benefit from additional therapy. So, don't know exactly about this situation, but I do think there's a little bit more data that could be added here, which would be MRD negativity. That would be something that would kind of help, at least in my mind, with the data that exists currently, which doesn't necessarily say that people would be cured, but if we couldn't detect it, then there might be a pathway to talking about whether somebody could be off therapy. Knowing whether somebody is definitely cured takes time. We wouldn't know that, until later on down the road, but it does seem like there might be a path to discontinuation of therapy safely with close monitoring, if somebody has a really deep response to treatment.